Hi, I am India Howell, the co-founder of the Tanzanian Children's Fund.
My name is Peter Leoni Masi, also a co-founder of Tanzanian Children's Fund.
And here we are again, celebrating another milestone.
And wow, it has actually been an adventure of our lifetime.
Well, way back 20 years ago, there were countless kids living on the streets in Arusha and Karatu. Were trying to forge a life on their own, as young as 4 and 5 and 6 years old. So we thought, let's attack this problem before it hits the street. Let's identify kids and let them be part of a new kind of family, a family that's forever.
I never expected this is going to be such a big, wonderful family. And I think we are very lucky to start with the number 17 because it gave us a very good experience in terms of learning what are the requirements of the kids. Because guess what? There was nothing in this Oliani ward that was there actually to help us to raise kids.
What I learned was the things I thought were already in place. Like, there's a nice public school down the road, check that box. Oh, there's a hospital in town, check that box. I found out that the school was not a school. It was a really bad daycare center. I'd take my kids to the local doctor and later found out that he was actually a lab tech. I learned very quickly that this ship was going to be floating on its own. It also takes a long time to lift an entire community of 10,000 from the cycle of poverty. We've made tremendous progress in the last 20 years. And many say, why aren't you done? Well, it's the same thing you would say to a parent after 20 years who has a kid, why aren't you done? It takes time.
I think the interesting thing about the place where we are now is it's so easy to see how much has been done and how much success we have achieved and the progress we've made, while still looking forward and seeing how much left there is still to do.
Every single programs that we have established, had it been education, healthcare, economic empowerment, provision of safe place for the kids. We will keep doing that.
Now that sort of that groundwork is in place and the foundation is there, it's how do we build upon that? How do we treat more patients? How do we get more kids in school? How do we get more kids qualifying for college and university? And how do we make sure that every single parent in this catchment area has the opportunity to put food on the table?
Now RIP has been like empowering a lot of women's and men's, and economically we can see people now, they have like 3 meals in a day, they can send their kids to school. You can see they have been trying to improve their households.
What we do for the patients, we provide a free service to the people of Oliani. For those people who surrounding us, they are not able to afford the medical expenses, TCF take the part to help them.
So here at TCF, when we partner with schools, we use a holistic approach. In our partnerships, we focus on a few core areas. First of all is hiring of teachers. Another area we focus upon is the built environment of the school. For example, classrooms, building, toilet facilities, fences, as well as with the professional development of teachers. Pretty much everything that a school needs in order to run properly. Just to ensure overall that we're really being accountable to the students and giving them the best education possible.
So I think that one thing that you often see is that when you solve one problem, it can at times illuminate a secondary problem or the problem that's right behind it. And that's really what we're starting to see now, I think especially within the education space. What we've done and the work that we've been able to accomplish at Katigi Primary School really showed us a gap that existed throughout the school district of Oliani. Kids graduating from there were headed to Oliani Secondary School with the exact skill set that they need to succeed at the next level. But you had 2 other primary schools in the school district where students were barely scraping by. You know, the student-teacher ratio was still 100 to 1. There were no resources. Classrooms were overcrowded. So what we're going to be doing over the next 5 years is going into those 2 additional primary feeder schools, Oldiani Primary and Mayali Primary, to make sure that they reach the same standard that Gatiki Primary School has. What we saw at the secondary school was incredible results. You know, students were staying in school, more students than ever were passing, but at Oldiani Secondary School they were passing, but maybe with C's and D's. And we strive to make sure that students pass with A's and B's. So there was a different problem that our usual model of intervention wasn't solving. And what came out was that students were walking a significantly longer distance to school at the secondary level than at the primary school level. And now we are in the process of opening and building dormitories. So by the end of our first phase, we will be housing over 400 students by 2028 to make sure that we can make that Oldiani Secondary School campus a cohesive, supportive boarding environment for students, that they are able to get the most out of secondary school.
For now, we have over 150 staff members who work day in and day out to meet the needs of Rift Valley Children's Village. The goals of work together. All workers of Rift Valley Children's Village have been given the position of being Rift Valley family, and this inspires a lot.
We have a very good team of the social workers. Some of them actually, for instance, Jonathan has been here for, I don't know, 20 years.
My name is Jonathan Urio. My role here is a social worker. I've been working here since 2005. How I do remember the old days, it used to be a lot of fun during those days because we used to have like a lot of little kids. So, and I was young too.
I think the other really unique piece of where we are today is that we have such a spectrum of ages. You have 30 young adults, they're independent, they have jobs, but just like any young 20-something, they call home when they need advice. You have 45 students that are in college and university. You have another 30 teenagers. Then you have everything down to 1- and 2-year-olds.
People often ask me, does TCF look today the way I had expected? And I can say unequivocally, no. I had no idea how our organization would grow and thrive, how we would really be able to span out and not just raise up a family, but also a community.
So if you lift one person, if you give a hand to one child, when that child graduates university or college, they actually go back to the community and lift another one. That ripple effect that I've seen in the Oldiani community, had it being from the healthcare assistance that we're providing, education that we've been providing, scholarships that we've provided for more than 100 kids, the impact has been very significant in terms of bringing changes and development to the Oldiani families, because those kids now are coming back to the community. They are helping their parents to acquire land, to build houses, help brothers and sisters to go to school, and that's what I want to see.
Many years ago, when I joined this beautiful family, my life changed. My life looks full of possibilities now, and I'm really grateful for having the opportunity to chase for my dreams.